Hello there, and first of all, I'd like to say thank you very much for logging onto this video. Okay, if you don't know me, my name is Bond, Dr. James Bond. I'm a health and fitness expert, and I work with people who want to improve their quality of life, particularly those who want to lose weight. What makes my service different is that I'm the only personal fitness instructor in the north of England who's a qualified medical doctor, and therefore I can take on the super high risk cases that other fitness instructors cannot or will not bear. So you might ask yourself, why is an obesity expert talking about cancer? Well, this Friday, Channel 4 are hosting an event called Stand Up to Cancer. Wholly admirable. The reason being, depending on your geographical location, between 1 in 8 and 1 in 3 people in your area will die of a cancer-related disease. Okay? Cancer can very often be without symptoms. Okay? So the other reason why an obesity expert is talking about cancer is because obesity does put you at risk of certain cancers, such as cancer of the uterus. But here's the worst thing. If you are obese and you might need surgery to relieve your cancer, here's the horrifying thought. Your obesity might put you at risk of anesthetic death, because basically if you're too obese, the anaesthetist will find it pretty damn difficult to put you under anesthetic, okay? And technically, to perform the surgery, it can be somewhat more difficult. So please don't get yourself overweight. Anyway, I'll come with it in a minute. If you want to avoid cancer, I'm going to go through a few things that you need to do to avoid cancer. And yes, a lot of it is what I do. First of all, I don't drink. A lot of cancers are amenable or caused by alcohol, or at least alcohol puts it high risk. I don't smoke. Practically every cancer you can imagine is basically made worse by smoking. Okay? Don't take drugs. Okay? Illegal drugs do put you at higher risk. Okay? Tea and coffee. I'm not sure about tea, but coffee. Don't take decaffeinated coffee. Do you know how they remove caffeine from coffee? They rinse it out with benzene, which is the most carcinogenic compound known to man. So don't take decaffeinated coffee. Okay? And what do you call it? Try to have a vegetarian diet, or at least a very, very high fiber diet. So a lot of common cancers are less common among vegetarians. Okay? When I was a medical student, I used to kind of have a little moment of sadness to myself when a patient used to come in and be diagnosed with a disease that vegetarians rarely get. I used to have a private moment of sadness. Anyway, let's go through the common cancers and let's see what we can do about them. Okay, the first one. Well, first of all, let me go back another instant. When I was a third-year medical student, I did a attachment with chest medicine at the Northern General Hospital. And although I didn't particularly like this consultant, I actually did admire him for one thing he did. A lady came in, and this person had obvious symptoms of a certain kind of cancer. And what actually happened was that she actually did say, "Doctor, do you think it's cancer?" And he blatantly just came straight out with it. He said, "Yes, I think it's cancer." And the reason he did that was he wanted to make sure the patient knew the diagnosis. Now, I admire him for that, because when I used to work in hospital, you'd be amazed at how many people didn't know their diagnosis. Goes against every ethical principle of medicine there is, but that's what actually happens. Okay, so let's go through the common cancers. Skin cancer. Okay, skin cancer is largely caused by exposure to excess sunlight. Okay, now we all like to sunbathe, me included. Okay, but the thing is, don't sunbathe between 11 a.m. and 2 p.m. where the sun rays are the strongest. Okay. The Australians have this wonderful thing called a slip, slap, and slop. That's basically slip on a hat, slop on some sun cream, and basically wear a shirt. Okay, on peak hours. The other thing is try to limit your exposure to sunbeds for the same reason. Other thing I would also recommend you do to avoid skin cancer is basically use the maximum strength sunscreen you can get. Forget this SPF 5, SPF 10. Find the strongest strength that you can get and use that. It's the best way to do it. Okay? Now, the other thing is, let's go from oral cancer. Oral cancer or mouth cancer is largely limited to people who have a lot of spices and smokers. Okay? People expose themselves to tobacco. Unfortunately, I actually have a relative who has actually developed oral cancer because he's been chewing tobacco, okay, or certain things called palm in India, basically, which can expose you to. So don't expose yourself to that. Okay, so don't chew tobacco. Okay, you're going to find a lot of these cancers I talk about are largely limited to smokers. Okay, throat cancer. Okay, it's a devastating cancer, and it's practically almost exclusively to smokers. And once you get it, it's a long, slow, painful death. Before I forget, going back to skin cancer, if you get a skin cancer on the pinna of your ear, which is this, okay, and that spreads into your brain, forget it, mate. You've only got weeks because a long, slow, painful death is certain. Okay, it's simple as that. So if you do go out sunbathing, cover your ears up. Really, really important. Okay, let's go for my next. Lung cancer. Lung cancer is practically exclusively among smokers. There are some rare forms of lung cancer which are among people who've been exposed to asbestos, called mesothelioma, and certain types of radiation or petroleum products, but they're comparatively rare. Lung cancer is almost exclusively among smokers. And I remember, actually, the funny thing is, I did train under a chest physician when I was a final year medical student who was a smoker. I couldn't understand that. Anyway, cancer of the esophagus, okay? Smokers and drinkers are the commonest group of people who get it. And trust me, if there's one cancer you don't want to get, it's cancer of the esophagus. Because the thing here is, once you get it, it spreads. And it's a nightmare. I'm not saying that if you're a non-smoker and non-drinker, you won't get these cancers. You could do, but the risk is a lot less. Okay. Bowel cancer. Okay. Bowel cancer is largely a disease of people who have low fiber intakes, okay, and a family history of exposure to certain standard radiation. But the thing is, it's a lot less common among vegetarians or people who have high fiber diets. Now, we don't know if the excess vegetables or fiber is acting as a protective effect, or it's because a high fiber diet means anything carcinogenic is basically passed out quicker. We don't know. But do massively increase your intake of vegetables. Pancreatic cancer. This is the one I really hate because it is almost exclusively among smokers. And if you get it, you've got 6 months. Okay? It's almost exclusively among smokers. And yes, the stupidity was, when I was a medical student, I trained under a gut surgeon who basically was a smoker. I couldn't understand that for the life of me, but that's a different story altogether. Pancreatic cancer is a deadly cancer, and once you've got it, you've got 6 months at best. Okay? And it's almost exclusively among smokers. Let's move on my list. Bladder cancer, that's largely linked to people who are exposed to aromatic dyes, particularly those who've worked in the rubber industry. So unfortunately, not much we can do about that. Now, ladies, breast cancer, okay? Things that put you at risk of breast cancer: a family history, cancer of the breast, not having any kids, okay? That puts you at a higher risk. Other thing is, ladies, once a month, you need to check yourself, okay? Go to the NHS website and you can find some good websites where you can check yourself. If you find anything that concerns you, please make a routine appointment with your family doctor who can help you, okay? It's really, really important, okay? My dad's a former family doctor. He's now retired. And once a month, he'd make sure my mum and all our female relatives checked themselves once a month. And guess what happened if they didn't do it? They were grounded, literally. Which brings us to the next point. For the guys, one of the commonest, I actually lost my best friend to testicular cancer. Okay, the commonest cause of that is undescended testicles at birth. Okay, however, every gentleman once a month needs to check himself for any lumps or anything abnormal in his testicles. If you find anything that concerns you, please make a routine appointment with your family doctor who will get it checked out. The best way to do things. Okay. And again, when I was a kid, if we didn't do it, my dad grounded us. Okay. Ladies, cervical cancer. Okay, we've got a wonderful vaccine now against it. Great. But until it's universal, please make sure you get your cervical screenings. In the UK, it's once every 3 years. In Germany, it's every year. In fact, let me tell you a funny story. When I was a fourth year medical student, we had this wonderful lecture on the cervical cancer screening program, and this lecturer said that the only benefit into having a yearly screening as opposed to every 3 years is a 1% improvement in mortality. And I thought to myself, mate, have you got a wife or any female relatives? Have you thought of saying that to the person involved? I just couldn't understand that. But yes, cervical cancer screening, very important you go for them. It's linked to a virus called the human papilloma virus. Ladies, please don't take this offensively, but reduce your number of partners. Basically, women who have the highest number of partners are at the highest risk of cervical cancer. By conversely, celibate nuns are at practically no risk of it. Okay, so that's a different story altogether. Cancer of the endometrial or the inner lining of the uterus, late menopause, not having any kids, being obese, and basically, as I said, not having any kids. It is largely preventable by if you have a couple of kids, okay, or take a combined pill. I'll come on to that in a minute. Okay. Ovarian cancer. Now this is a silent epidemic, ladies. Okay. Ovarian cancer is a lot less common among women who basically have fewer monthly cycles. So basically, women who've been on the pill for a couple of years or have had a couple of kids. Okay. So basically, ladies, please don't take this offensively, but if you want to protect yourself against having breast cancer, ovarian cancer, endometrial cancer, be on the pill for a couple of years and have a couple of kids. Okay. That said, I do appreciate that if you've got a history of breast cancer, you can't have a combined pill, but do take medical advice on that. Okay. Guys, prostate cancer. This is the commonest cancer that affects middle-aged men. Okay, now the thing here is, it's so common, it's going to be considered normal, but it's less common among people who have a low fat intake. Okay, a lot less common among vegetarians as well. Those are the commonest cancers that affect us. The things that put you at lowest risk, well, the things that put you at risk are alcohol, cigarettes, decaffeinated coffee, a poor lifestyle, and basically being obese. Okay. If you find anything that concerns you, please make a routine appointment with your family doctor who will help you. Now, the other thing here is, look below. I'm starting up a free, not free, I do have a free online weight loss system, but I'm starting up a membership site very soon. And I will give Cancer Research UK £1,000 if 1,000 people get on this on a pre-sale. Okay, I'm doing a pre-sale. This is what happens. When you get on the system, every Sunday you'll get an email from me. And basically that will remind you to log into the back office, and there'll be a 15-minute video to talk about one health and weight loss subject for that week. That's all I want you to concentrate on. Now it's really cheap. It's £4.33 a month, i.e. £52 a year, £1 a week. But I'm doing a pre-sale of £30.07, 3007 with the name like James Bond. And if 1,000 people do it, then and get on the system, then I will give £1,000 to Cancer Research UK. My name's Bond, James Bond. You shaken but not stirred, and go and have a look at the link below. See you later. Bye bye.